everyone, welcome back to my channel. Okay guys, in my previous video I talked about the etiology and types of inflammation. In today's video I'll be talking about the cardinal signs of inflammation. The link to my previous video is in the description box. Do well to click on the link so you can see my video on the etiology and types of inflammation. So like I said, in today's video I'll be talking about the cardinal signs of inflammation. Okay, let me give a little recap. Inflammation is a complex process of vascular and cellular alterations that occur in the body in response to injury. Inflammation is very beneficial to the body because it activates the already existing immune system to do its work or its job in the body. And there are two types of inflammation: acute and chronic inflammation. I mentioned the etiology or the causes of inflammation, and in today's video, like I said, I'm talking about the cardinal signs of inflammation. Cardinal signs means the main things to look for. When we talk about cardinal signs in inflammation, we are referring to the key things that happens in an inflamed body. Inflammation can be recognized clinically by these signs. There are 5 cardinal signs of inflammation. The first 4 signs were described by a man whose name is Cornelius Celsius. The 5th sign by another man whose name is Rudolf Virchow. So the 5 cardinal signs include redness, in Latin rubor, swelling, in Latin tumor, heat, in Latin calor, pain, in Latin dolor, and loss of function, in Latin functio lasse. Okay, so we have here redness, swelling, heat, pain, loss of function as rubor, tumor, calor, dolor, and functio lasse. So I'm talking about the signs one after the other. The first one we have here is redness, in Latin rubor. An inflamed area will appear reddish in color, and this is because during inflammation there is vasodilation. That is, the blood vessels get wider, and this increases blood flow to the inflamed area. And when there is excess blood in that area, it is known as hyperemia. So now the inflamed area containing excess blood will appear reddish in color. So that is to say that redness is due to vasodilation, which leads to hyperemia. The second sign, swelling. An inflamed area also appears swollen or is swollen, and this is because during inflammation there is also vasodilation, like I've said, which leads to hyperemia. Remember that blood has volume, and so the part of the body containing excess blood will become larger than normal. Another cause of swelling is increased vascular permeability that also happens during inflammation. This means that the blood vessels in the inflamed area allow substances like fluids, proteins, and blood cells to pass through it easily, and these substances move from the blood vessels into the surrounding tissues outside the blood vessels. The protein-rich fluids contain blood cells that leak out of the blood vessels is called exudates, and the accumulation of exudates in the tissues due to the increased vascular permeability is known as edema. Edema is the major cause of swelling. Remember I mentioned vasodilation, which leads to hyperemia. So the 2 causes of swelling during inflammation is vasodilation and edema, but edema is the major cause of swelling during inflammation. Okay, so the third sign that we have here is heat. During vasodilation, that is when the blood vessels get wider during inflammation, more blood will flow through the vessels to the inflamed area, and the blood flowing is coming from the higher interior temperature of the body and carries warmth to the periphery, and this contributes to the sensation of heat in the inflamed area. Also, another reason why there is heat in the inflamed area is due to the increase in the rate of metabolism. So in conclusion, heat is due to vasodilation and increased metabolic activity at the inflamed site. Alright, so the fourth sign, pain, in Latin, dolor. The inflamed area is painful, and pain occurs partly from increased pressure on sensory nerve endings and by stretching of tissues from accumulation of exudate. Also, chemical mediators are released following injury, and these chemical mediators produce pain. The fifth sign is loss of function, in Latin, functio lassei. Loss of function is due to a combination of pain, swelling, and destruction of tissues, and this will result in the inflamed area or the part of the body undergoing inflammation to lose its function. Let's say it's the eye. Imagine your eye is swollen and very painful. You won't be able to see properly with the eye again. You prefer the eye being closed, so the eye will no longer be able to perform its function of seeing, and that is loss of function. If it is on your hand or the leg, you won't be able to walk properly or use your hand properly because of there's so much pain, and then your hand is swollen, and also due to tissue destruction. Okay guys, so that's it on the cardinal signs of inflammation. I also want you guys to know that these signs occur in both acute and chronic inflammation, but they may present differently in each case. In acute inflammation, the signs are typically more pronounced and sudden, whereas in chronic inflammation, the signs may be less severe and persist over a longer period of time. Also, again, I want you guys to know that these are not the only signs seen during inflammation, but they are the main indicators of inflammation. Other signs can include fatigue, changes in blood tests, and so many others, which vary depending on the specific cause and the location of the inflammation. And that's it guys on today's video. Thank you so much guys for watching. Please don't forget to hit that subscribe button, ring the bell icon, and also share this video. I'll be glad if you drop your thoughts in the comment section below. Thank you. Bye.